Mike from RunPhys.com. Thank you for watching today's video. Please consider subscribing to the blog if you have not already. That way you don't miss any of these helpful videos that will assist you in your journey to becoming a better runner. Today I want to talk to you about taking care of your muscles. Essentially ways that you can perform self-massage techniques to help stay on top of any tightness or kind of recurring issues that as runners we all struggle with. So what I want to talk to you today specifically about is the way you can perform some myofascial type release on your own muscles. Now, it's very common to use foam rollers, lacrosse balls, tennis balls, things like that to help stay on top of muscle tightness. And that's fine and that's very good, especially if that's part of your routine and you know that that works for you. But what I want to talk to you about today is how to get even more thorough with some of these massage type techniques. What that entails is considering the muscle and the fascia interaction. So the fascia will adapt to the movement patterns that you have. Fascia is connective tissue that runs all throughout your body. And if you have a muscle that's very tight or overworked, or a pattern that's very overdeveloped, that fascia will adapt to that and then kind of put the squeeze on some of those muscles. So that way if you go to stretch those muscles or use a roller, then that will maybe temporarily help the muscle, but then that fascia will try to kind of bring it back into tightness. And so a way that you can help address that is to, when you give pressure to a muscle, is give pressure but then also give a direction. And that direction should be intentional based on where the fascia is kind of wanting to take the muscle. And so what I want to show you is ways that you can do that to yourself in some of the common muscles that runners struggle with having tightness in. And one of the questions I get asked is, how much pressure, as far as is the most pressure I can generate the best? Well, not necessarily. What you want to find is that sweet spot of enough pressure to create a change in the muscle and the fascia, but not too much pressure, which could cause the muscle to guard, or you could cause some real skin irritation in that area. So some of those areas that we're going to address today are your calf, your tibialis posterior, your tensor fasciae latae, which is the front and side of your hip, as well as your glutes. So to address the calf, you get down on the floor or in a chair, and you're going to find some areas of tightness right in the middle of your calf. You're going to push in, and then again you're going to push either up or down, wherever you feel like it's easier for the muscle to go. So push in, push up or down, and you're going to hold that for a few seconds, upwards of maybe 30 seconds, until you feel things start to relax. And you're going to do that 3 or 4 times within that muscle to help really thoroughly loosen up the muscle as well as the fascia surrounding it. Next, with the tibialis posterior, you're going to stay in that same position, except for you're going to find the distal part of the medial shaft of the tibia. And what you'll do there is same thing. You're going to find a tight or a tender spot, put moderate amount of pressure in, and then you're going to again either put, while you're holding that pressure in, drag it up or down, wherever it feels like it's easier to go for you. And you're going to hold that again for about 30 seconds until you feel it relax, and repeat that 2 or 3 times in that same area. Next, for the tensor fasciae latae, or the TFLs we call it, which is a big influencer of your IT band, you're going to be in a seated position with your knees bent up, and you may have to play around with where you feel the most comfortable. You're going to use your thumb, use your knuckles to get into there and put pressure, and then again push down, push up, whichever way you feel like you get some relaxation of the tissue. And with this you're going to do it for 2 or 3 minutes, and then what you should feel is that a moderate amount of pressure, moderate amount of tenderness, but that it resolves and improves as you do it pretty methodically. For the glutes also, you're going to be in a seated position. You may need to play around with the position of your knees and stuff, but you're going to also put pressure in, gently drag it down, and repeat that over and over again until you feel like the muscle has really loosened up. So those are some ways that you can take care of your muscles, and those can be applied to other muscles in the body as well, depending on your individual needs. But those will help you stay on top of muscular tightness and hopefully even make progress, so that way those muscles stop being tight so often. So give those a try. Let me know how they go. If you have questions about those or other muscles, please feel free to reach out. Otherwise, have fun with them. Run fast, friends.